Endocrine Pharmacology Review Questions. This inhibits the release of corticotropin-releasing hormone, A. Anabolic steroids, B. Somatotropin, C. Glucocorticoids, D. Gonadorolin. The answer is glucocorticoids. Corticotropin-releasing hormone release is inhibited by glucocorticoids. This is an estrogen antagonist which stimulates gonadotropin-releasing hormone, A. Danazol, B. Lactin, C. Stenozol, D. Clomiphene. Answer is D. Clomiphene is an estrogen antagonist which stimulates GnRH release. Which of the following releases follicular-stimulating hormone and luteinizing hormone? A. Gonadotropin-releasing hormone, B. Corticotropin-releasing hormone, C. Thyrotropin-releasing hormone, D. Somatorolin. The answer is letter A. Gonadotropin-releasing hormone releases FSH and LH from anterior pituitary. Which of the following are not a GnRH agonist? A. Gonadorolin, B. Leuprolin, C. Bizrelin, D. None of these. The answer is letter D. Gonadorolin, leuprolin, and bizrelin are GnRH agonists. This is used to test the somatotropin secretion. A. Somatorolin, B. Sermorelin, C. Octreotide, D. Proterolin. The answer is letter B. Sermorelin is an analog of somatorolin and is used to test the somatotropin secretion. Somatotropin deficiency results in blank. A. Acromegaly, B. Dwarfism, C. Gigantism, D. None of these. Answer is letter B. Dwarfism is due to somatotropin deficiency. One of these is a dopamine agonist. A. Chlorpromazine, B. Bromocriptine, C. Thiazepine, D. Haloperidol. The answer is bromocriptine. It is a dopamine agonist. Chlorpromazine, thiazepine, and haloperidol are under dopamine antagonists. Prolactin controls blank. A. Function of mammary gland, B. Milk production, C. Both A and B, D. None of these. The answer is letter C. The function of mammary gland and milk production is controlled by prolactin. It is due to overproduction of somatotropin in young ones. A. Acromegaly, B. Dwarfism, C. Gigantism, D. None of these. The answer is letter C. Gigantism results in excess production of somatotropin in young ones. In males, follicular-stimulating hormone maintains the integrity of seminiferous tubules and spermatogenesis through an action of blank. A. Sertoli cells, B. Leydig cells, C. Vas deferens, D. Testes. The answer is Sertoli cells. This controls the synthesis and release of adrenal glucocorticosteroids. A. Somatotropin, B. Gonadotropin, C. Somatostatin, D. Corticotropin. The answer is letter D. Corticotropin is an anterior pituitary hormone which controls the synthesis and release of adrenal glucocorticosteroids. The absence or deficiency of this hormone causes diabetes insipidus. A DHB, a CTHC, GnRHD, FSH. The answer is letter A. Antidiuretic hormone regulates water metabolism of the body through its action on distal convoluted tubule and collecting tubular epithelium of nephron, causing reabsorption of most water passing through the nephron. Hence, the absence or deficiency of a DH causes diabetes insipidus. The following are the mode of action of antidiuretic hormone except A. Activation of adenyl cyclase, B. Increase in formation of CAMP, C. Phosphorylation of channels inhibiting water reabsorption, D. All of these. The answer is letter C. The mode of action of a DH is activation of adenyl cyclase, increase in formation of CAMP, and phosphorylation of channels promoting water reabsorption. The following decreases vasopressin effects except A. Carbamazepine, B. Colchicines, C. Lithium, D. Vinca alkaloids. The answer is letter A. Carbamazepine increases the effect of vasopressin or antidiuretic hormone. The following are synthetic analogs of vasopressin except A. Desmopressin B. Lipressin C. Nafarelin D. None of these. The answer is C. Nafarelin is a GnRH agonist. This vasopressin induces diuresis. A. Felipressin B. Lipressin C. Desmopressin D. Dimeclocycline. The answer is D. Dimeclocycline induces diuresis by inhibiting the action of A. DH in distal convoluted tubules and collecting duct. The overproduction of glucocorticosteroid results to A. Cushing's syndrome B. Addison's disease C. Acromegaly D. Dwarfism. The answer is letter A. Cushing's syndrome is due to excess of glucocorticosteroid formation and/or release. It induces insulin secretion promoting glycogen storage in liver. A. Hypoglycemia B. Hyponatremia C. Hyperglycemia D. Hypernatremia. The answer is letter C. Hyperglycemia induces insulin secretion promoting glycogen storage in liver. All of the following are metabolic effects of adrenal corticosteroids except A. Carbohydrate metabolism B. Protein metabolism C. Fat metabolism D. None of these. The answer is letter D. Carbohydrate, protein, and fat metabolism are the three metabolic effects of adrenal corticosteroids. Which of the following is not true about corticosteroid therapy? A. Therapy should be withdrawn gradually. B. Dosage should be individualized. C. Use should be done during active infections. D. Corticosteroids do not cure the disease, but give relief due to anti-inflammatory effects. The answer is letter C. The use of corticosteroids should be avoided during active infections, unless compulsory. If used, the microbes may spread over extensive areas. The following are clinical uses of corticosteroids except A. Mastitis in cattle B. Conjunctivitis in dogs C. Eczema in horses D. All of these. The answer is letter C. Corticosteroids are used to treat lameness, conjunctivitis, and iridocyclitis. These drugs are used to treat Cushing's syndrome. A. Aminoglutamide B. Ketoconazole C. Both A and B D. None of these. The answer is letter C. Aminoglutamide and ketoconazole are drugs used in treating Cushing's syndrome. The use of corticosteroid is contraindicated in the following except A. Diabetes mellitus B. Diabetes insipidus C. Hepatic insufficiency D. Renal sufficiency. The answer is letter B. Corticosteroid is contraindicated in diabetes mellitus, hypertension, renal sufficiency, late pregnancy, corneal ulcers, and hepatic insufficiency. Which of the following exerts anti-inflammatory and immunosuppressive effects? A. Vasopressin. B. Mineralocorticoids. C. Gonadotropin. D. Glucocorticoids. The answer is letter D. Glucocorticoid exerts anti-inflammatory and immunosuppressive effects which are generally regarded as pharmacological effects. The following drugs are corticosteroids except A. Prednisone B. Dexamethasone C. Carbimazole D. Hydrocortisone. The answer is carbimazole. It is an antithyroid drug classified as thiorilines. Which of the following are true about thyroid hormone? A. Stimulate metabolism B. Increase metabolic rate accompanied by increased oxygen consumption C. Influence growth and development D. All of the above. The answer is letter D. The following drugs are under thiorilines except A. Thiouracil B. Perchlorate C. Propylthiouracil D. Carbimazole. The answer is B. Perchlorate is an antithyroid drug classified as inorganic ions. These drugs do not cure disease but help in controlling the clinical manifestations. A. Antithyroid drugs B. Corticosteroids C. Parathyroid D. Glucocorticoids. The answer is letter A. Antithyroid drugs do not cure disease but help in controlling the clinical manifestations either by inhibiting synthesis or interfering with release of thyroid hormones. The following are classification of antithyroid drug except A. Thiourylines. B. Organic ions. C. Iodide. D. Iodine. The answer is B. The classification of antithyroid drugs are thiourylines, inorganic ions, iodide, and iodine. Thyroxine and triiodothyronine are blank hormones. A. Anterior pituitary. B. Posterior pituitary. C. Thyroid. D. None of these. The answer is letter C. The thyroid hormones are thyroxine and triiodothyronine, whose biosynthesis and secretion is under the control of TSH. Its secretion is stimulated by hypercalcemia and inhibited by hypocalcemia. A. Parathyroid. B. Calcitonin. C. Calcitriol. D. Vitamin D. The answer is letter B. Calcitonin secretion is stimulated by hypercalcemia and inhibited by hypocalcemia. This promotes bone formation. A. Parathyroid. B. Calcitonin. C. Calcitriol. D. Vitamin D. The answer is letter A. Parathyroid promotes bone formation by stimulating osteoblast activity and can be used to treat osteoporosis. Which of the following regulates bone metabolism? A. Parathyroid. B. Vitamin D. C. Calcitonin. D. All of the above. The answer is letter D. The bone metabolism is regulated by parathyroid, calcitonin, and vitamin D. The hypoglycemic action of biguanides is due to the following mechanisms except A. Inhibition of gluconeogenesis in liver. B. Increasing sensitivity of tissues to insulin. C. Advanced absorption of glucose from intestines. D. Increased peripheral utilization of glucose due to aerobic glycolysis. The answer is letter C. The hypoglycemic action of biguanides is due to inhibition of gluconeogenesis in liver, increasing sensitivity of tissues to insulin, delayed absorption of glucose from intestines, and increased peripheral utilization of glucose due to aerobic glycolysis. The following are first-generation sulfonylureas except A. Tolbutamide. B. Glipizide. C. Talazamide. D. Chlorpropamide. The answer is letter B. Tolbutamide, talazamide, and chlorpropamide are drugs classified as first-generation sulfonylureas. Which of the following lowers insulin secretion? A. Somatostatin. B. Galanin. C. Amylin. D. All of these. The answer is D. Insulin secretion is lowered by somatostatin, galanin, amylin, and pharmacologically by sympathetic system. Which of the following drugs does not cause insulin secretion? A. Metformin. B. Repaglinide. C. Tolbutamide. D. Actrapid. The answer is letter C. Metformin do not cause insulin secretion. However, presence of endogenous or exogenous insulin is necessary for their action. This is the fuel-generating hormone. A. Somatostatin. B. Thyroxine. C. Amylin. D. Glucagon. The answer is letter D. Glucagon is credited as the fuel-generating or fuel-mobilizing hormone. Which of the following increases blood glucose levels? A. Glycogenolysis. B. Lipolysis. C. Proteolysis. D. All of these. The answer is letter D. Glucagon increases blood glucose levels by enhancing glycogenolysis, proteolysis, lipolysis, and gluconeogenesis. The following are synthetic estrogen except A. Estrol. B. Estradiol. C. Mestranol. D. Hexastrol. Answer is letter B. Estrol, mestranol, and hexastrol are synthetic estrogen. Meanwhile, estradiol is a natural estrogen. This is responsible for development of secondary sexual characteristics of female. A. Estrogen. B. Progesterone. C. Testosterone. D. Oxytocin. The answer is A. Estrogen is responsible for the development of secondary sexual characteristics of female and control of proliferative phase of endometrium. Which does not belong to the group? A. Megestrol. B. Proligestone. C. Hydroxyprogesterone. D. Melangestrol. The answer is letter C. All of these are progestogens. However, megestrol, proligestone, and melangestrol are synthetic progestogens. Meanwhile, hydroxyprogesterone is a natural progestogen. The following are antiestrogens except A. Clomiphene. B. mifepristone C, cyclophenol D, raloxifene. The answer is letter B. Clomiphene, raloxifene and cyclophenol are antiestrogens. Meanwhile, mifepristone is an antiprogestogen. This is an antiprogestogen along with PGF2 alpha can be used to terminate early pregnancy. A. Clomiphene. B. Mifepristone. C. Cyclophenol. D. Raloxifene. The answer is letter B. Mifepristone is an antiprogestogen along with PGF2 alpha can be used to terminate early pregnancy. This is a natural androgen which is responsible for the growth and development of secondary sex characteristics in males. A. Testosterone. B. Somatostatin. C. Progesterone. D. Oxytocin. The answer is A. Testosterone is a natural androgen which mainly synthesized in interstitial cells of testes and is responsible for growth and development of secondary sex characteristics in males. This is used to sexual offenders. A. Flutamide. B. Mesterolone. C. Finasteride. D. Cyproterone. The answer is letter D. Cyproterone is used to depress libido in men, especially to those sexual offenders. The following are synthetic derivatives of testosterone except A. Stenozolol. B. Miberilone. C. Boldenone undecylonate. D. Nandrolone undecanoate. The answer is miberilone. The synthetic derivatives of testosterone are stenozolol, boldenone undecylonate and nandrolone undecanoate. Meanwhile, miberilone is a synthetic progestogen. Which of the following possess anti-androgen activity? A. Estrogens. B. Somatostatin. C. Vasopressin. D. None of these. The answer is estrogen. Estrogen and progestogen possess anti-androgen activity. This is a peptide hormone found in secretory granules along with insulin in beta cells of pancreas. A. Somatostatin. B. Thyroxine. C. Amylin. D. Glucagon. Answer is letter C. Amylin is a peptide hormone found in secretory granules along with insulin in beta cells of pancreas. It is a peptide hormone of pancreatic origin, which exerts inhibition of insulin and glucagon release within the pancreatic islets. A. Somatostatin. B. Thyroxine. C. Amylin. D. Glucagon. The answer is letter A. Somatostatin is a peptide hormone of pancreatic origin, which exerts inhibition of insulin and glucagon release within the pancreatic islets.